We don't know what's going to happen 2 years down the line, 1 year down the line. And people in Hayward and Middleton are really, really concerned about access to hospital care. And also, on the doorstep, I'm being told I can't get an appointment to see a GP. When I'm ill, I phone the GP, I can't get through. When I do get through, I'm told there are no appointments. People tell me the GP surgeries are full of locums, that they can't get any continuity of care, that the GPs are actually missing the diagnoses because they're seeing a different person every single time and there's just no continuity. And we know that's because the GP services are being underfunded. And what used to be an attractive profession for doctors to go into, GP work, is now seen as a really undesirable thing to go into, and we're just not training up the doctors to be GPs. We've got a real crisis in this country. I said I wasn't going to waffle on, and I can feel myself starting to, so I'm going to wind up now, but I just want to say how proud I am to be taking the NHS and Unite, hopefully, into Parliament on October the 9th. Thank you.
Saying that the NHS relies on the staff in our hospitals and in our communities. We've got health visitors in this audience, we've got theatre nurses, and they tell us about the stress. They tell us that they're feeling undervalued, and they tell us that they're working harder, trying to do more, but with less. Fewer resources, fewer staff, less money for patient care, and importantly, fewer clinically qualified managers. The stress. Last Friday I was meeting with some ambulance paramedics in Yorkshire. Health professionals punished for blowing the whistle on what they strongly believed was unsafe practice. Stripped of their union recognition, now banned from working overtime, never mind that there are hundreds of shifts not covered. A disgrace. Professional healthcare scientists in Northampton locked out. I mean, locked out. You know, this is unbelievable. Since when did we have a lockout in the private sector, let alone in the public sector, in our NHS? And in King's College Hospital and at St Thomas's, flagship teaching hospitals, one of them my local hospital, full-scale privatisation of pathology. The staff there feeling insecure and betrayed.
I want to say at the very beginning, I mean, I get tremendous support from the unions represented on this table. I'm extremely grateful for that. And together we have built a powerful campaign for the NHS. But the main thing I wanted to say to you tonight touches on what Rahana was saying when I walked in. I think I need to do more than that, don't I, than build a campaign pointing out all the things that the government is doing wrong. I now need to give you a plan that you can believe in, a plan that you can take to doorsteps with pride and passion and say, this is it, this is worth voting for, this is worth campaigning for. If you're a member of it, the NHS, who isn't a member of a political party, we want it to be so good that it motivates them to get out and get involved at the election. We need to make this coming election a referendum on the NHS. And you know, that is really encouraging to see Ed Miliband and Ed Ball saying over the weekend that the NHS will be the very top issue that we put forward as our election programme. And I'll finish on that by saying this. You know, 2 weeks ago, or just over 2 weeks ago, that afternoon we spent in Trafalgar Square when the People's March for the NHS arrived was an incredible event to be part of. Absolutely humbling to see. You know, what a demonstration of what the NHS means to the country. An incredible thing that Rana and the Darla mums that did. And I think, you know, the fact that the media weren't really there or weren't really interested was disgraceful, to be honest. But you know, people are noticing. They are seeing what's going on. The mobilisation is there, and we've got to build on what they achieved. I think we have already done that. People now see the NHS as the top issue. And I am going to need all of you in this room and beyond to mobilise behind the plan that we're developing. You know, this is about reconnecting Labour, isn't it, with people as well. So when we knock on those doors at the next election and people say, oh, there's no point, you're all the same, I want you to be able to say right back at them, oh no, but there is a point. This is a plan for a 21st century health and care service that has people at its heart, not profits. That's worth voting for. And if you can say that, and if you can say that with pride, then I will have done my job. Thank you very much for listening.